So today we are going to start with the first bone of the body with that we study in anatomy, that is clavicle. So about its peculiar features, first is it is a long bone. So it is the only long bone to lie horizontally. As we can see here, it is lying horizontally in our body. It is the only long bone to ossify in membrane. It is the only long bone having two primary centers of ossification. Ossification you will study in detail in further lectures of your college. So this is the bone having two primary centers of ossification. First bone to start ossifying. When ossification starts, every bone has different time period for the initiation of ossification. So clavicle is the first bone to start ossification. And third point is it is subcutaneous throughout. That is, it is just present below the level of skin. So this is subcutaneous. Now this is the view of clavicle superior and inferior view, and this is the lateral side and this is medial side. Here we can see this the side which is towards the center of the body is medial, and which is away is lateral side. So this was the view. Now next we will study about clinical anatomy. First is fracture of clavicle. It occurs in the junction between two curvatures of the bone. That is, this is convex and this is concave, and this is the junction between the two curvatures. This is the most common point for the fracture of clavicle, and it is the weakest point of this bone. So to cure this fracture, we bind 8 bandage like this for the treatment of fracture of clavicle. Next is congenitally absent clavicle, that is called as cleidocranial dysostosis. So in the image we can see that a person is lacking clavicle here, and this is X-ray picture, no clavicle is here. So next one is clavicular dysostosis, which is non-union of two primary centers of clavicle. As we studied in its peculiar feature that clavicle has two primary centers. One is medial lateral, one medial and one is lateral. So if they are not united, then that condition will be called as clavicular dysostosis, and medial and lateral part will remain separated, as we can see in this image. So that was all about the peculiar features of clavicle. Thank you.